Hello, I'm Dr. Trivedi, a doctor working in this clinic. May I confirm your name and age, please?
Hello, doctor. My name is Jason Mauman. I am 40 years.
Okay. How may I address you?
Doctor, please call me Jason.
Okay, Jason, Mr. Jason. Today we are going to discuss about your health issues. Is that all right?
Yes, doctor.
Okay. And during our discussion, I might take down some notes, which be strictly confidential. Is it okay?
Okay, doctor.
Okay. And can you please tell me in your own words? Okay. And during our discussion, I might take down some notes, which be strictly confidential. Okay.
Okay, doctor.
Yes, and now, Mr. Jason, can you please tell me in your own words what have brought you here today?
Doctor, this is for the last few months. I noticed I had this before that I had some rash over my wrist, and this was somewhat coming and going, but for the last few days, I noticed that these are also being issue. But this was not a issue to me.
Mhm.
Last time I had asthma attack, and this was severe. I needed admission 3 days back. And on that day, I told the doctor that I also have this asthma, this rash on my hands. And after that, the doctor thought that it might be something serious, so he sent me here.
Okay, okay. I will try my level best to find out what's actually troubling you. May I know that uh, when did you first notice rash in your life? This rash?
Maybe 5 or 6 months ago. I cannot exactly tell you.
Okay, okay. For 5 or 6 months ago. Can you please tell
Yes.
me the exact site where did you experience this?
Over my wrist,
Okay, and can you please tell me whether it's the front side of your wrist
front
or
side,
back side? Sorry.
front side.
Okay, front side. And can you please tell me whether both wrists are affected or only one wrist
Both wrist and also my around my ankles.
around your ankles? Are both of them almost same?
Yes, doctor.
Okay. And do you remember that any other parts of your body are involved?
Some rash also present over my tongue,
Okay, okay. Mm-hmm.
but that is
When
different.
did hmm?
That is different.
Sorry, sorry. Can you please repeat?
The rash over my tongue is different from rash over my wrist or ankle.
Okay, okay. Well, you told me that the rash over the wrist came around 5 or 6 months back. And what about the ankle rash? When did it come?
I think all of those came simultaneously.
All those came simultaneously. Okay. And okay. And can you please tell me that did it come all on a sudden or gradually?
Gradually.
Gradually. So it increased in size. You were
Yes.
telling me.
Yes, doctor.
Okay. And at the beginning, how was it? What was the color of it at the beginning?
It is somewhat violet color.
Violet color.
Yes.
Okay. And has it been all the same, this color?
Yes, doctor.
Okay. And and it just increased in size. Am I right?
Yes, doctor.
Okay. And any other changes over time, over the
Uh,
5 6 months?
Easing, doctor. Easing that is also having. I have been noticing that easing is for last 1 week. There was no easing before.
Oh, itching for last 1 week. Okay. And it's violet in color. Okay. And have you noticed any pain?
No,
Okay. Any oozing from those rash sites?
no,
Okay. Any bleeding?
no.
Okay, well, may I ask you that have you ever had any injury in the last 5 or 6 months in your body? Any skin injury or anything cut or something like that?
Yes, doctor. I got an injury by
Mm.
bike accident.
You got an injury of bike and okay, and have you noticed that uh, any type similar type of rash in that site of
Yes, yes,
injury?
doctor. Yes. I
Okay.
got an injury around my knees, and also I noticed that there's some skin stains like my wrist is present there.
Okay. Okay. That's all right. And okay. And may I know that the priest? Okay. Well, may I know that have you ever noticed any fluid-filled lumps over those rashes?
Now,
Okay, okay, and any pass in the rashes,
no,
any ooze or pass, thick discharge.
no.
Okay, and have you noticed that there anything that makes this rash feel better? That it makes it
Yes,
yeah,
doctor.
okay,
Because I take some inhalers called steroid inhalers. After
mm-hmm.
taking those steroid inhalers, I think
Mm-hmm.
that it is somewhat better. And also, I sometimes need to take steroid tablet for my asthma. And during that time, it goes better.
It goes better. Okay, and is there anything that makes it worse, like any stress or anything like that?
I haven't
Have
noticed.
you noticed? Okay, and okay, and have you may I ask you that have you noticed any changes in your nail?
Yes, doctor. My nails are going off. I think I lost nail of my two fingers, and others are becoming somewhat brittle and
Okay,
they easily they easily get fractured.
easily gets fractured. Okay, okay, uh, okay, okay, and you told that you told that there were some problems in your tongue, some rashes. Can you please describe it for me?
A white doctor, a white patch over my tongue and around my gum.
Okay, and was it painful?
No,
Is it still present?
yes, doctor.
Okay, has it been the same for the 6 months or has it been growing?
No, it is for last few days, maybe for last 15 days.
Okay, and okay, and it's for the last 2 days. Okay, and have you noticed any pain or itching in the tongue zone?
No,
Okay, any bleeding from that zone?
no,
Okay, okay. Now let me ask you some other questions now. That do you have any headache?
no,
Any any rashes around your ear or in hairline zones?
no,
Okay, and any rash around in your cheeks or nose and any parts?
no.
Okay, and how about your vision? Is that all right?
Yes,
Okay, any other soreness in your mouth?
no,
Any other rashes in your body?
no, doctor.
Okay, and okay, any difficulty in your swallowing?
No,
Any difficulty in speech?
no,
Any weakness in any parts of your body?
no,
Okay, and any joint pain? Have you noticed any joint pain?
no,
Okay, any pain in your back?
no.
Okay, and any okay, and what about your water work?
It's fine, doctor. I haven't noticed any
Have you
problem.
ever noticed? Okay, okay. And how about your bowel movement? Is it all right?
I think all right.
Okay, and may I ask you that do you have any chest pain?
No,
Any shortness of breath?
when I get asthma attack, then at that time I feel shortness of breath. Otherwise, no.
Yes, yes, I am getting into that. Do you have any racing and pitching in your of your heart?
No,
Okay, any swelling in your legs?
no,
Do you have to use extra pillows?
no.
Okay, since you have asthma, I think you also suffer from some chest tightness or noisy chest. Is it all? Is it right? Correct?
Yes, doctor.
Okay, may I know that how well is your asthma control nowadays?
Not very good.
Okay, when were you first actually diagnosed with your asthma?
I had asthma in my childhood, and after that, I didn't need to take any medication for a quite long time. For last 3 years, I need to take asthma medication. But I took salbutamol initially, and for last I think 7 or 8 months, I am also taking the viclometazone.
Yes, bifenthrin. Okay. And since even then it's not well controlled.
No. I sometimes it
Okay.
goes bad, and at the time my doctor said me to take steroid tablets. I need to take steroid tablets, and I took steroid tablets 2 times over the last 6 months.
Okay. May I ask you some other questions now? Actually, do you have any known allergy to anything, any
No,
food or anything?
no,
Okay, any dust allergy, any mite allergy, pollen
no,
mites,
no,
pollen.
no,
Okay, and have you ever noticed any changes in your rash when you exposed to soap or anything like that?
no,
Okay, and okay, and mm, may I ask you some other questions now? Do you have any known disease condition other apart from your asthma?
no,
Okay, and may I ask you that what medications do you take apart from the salbutamol and steroids?
no. I don't take anything.
Okay, any over-the-counter medication?
No,
Any herbal medication?
no,
May I ask you that have you had any blood transfusion through blood channels?
no, doctor.
Okay, that's all right. I'm just going to ask you, okay, a personal question about medication. I'm sorry to ask. May I know that do you ever take any recreational medication?
No, never.
Oh, that's all right. May I know that was there anybody in your family having similar type of rashes or any other skin condition?
No, doctor.
Okay, that's all right. Any other known condition in your family that runs in your family?
No,
Okay, and may I ask you some other personal questions? I'm sorry to ask, but do you smoke?
no,
Okay, do you drink alcohol?
no.
Okay, and may I know what you do for a living?
I'm a school teacher.
Okay, and may I know that is your when you use a chalk or something like that? I guess you have to use it. Does it get worse?
No,
Okay, that's all right. And okay, and may I know that have you okay, and have you recently okay, and may I ask that has your job been affected by this condition?
no, not much.
Okay, that's all right. And may I ask you again that have you been recently to travel to any other country?
No,
Okay,
don't see
and
many.
okay, I'm sorry to ask you some very personal question. I'm very sorry to ask, but may I proceed?
Okay, doctor.
Okay, may I know the whom do you live with?
My wife.
Okay, I'm so very sorry to ask, but may I know that have you ever been involved in any casual relationships?
No, no,
Okay, that's all right. I'm very sorry to ask, actually. Okay, and may I know that did you have any episodes of raised temperature recently?
no,
Okay, any loss of weight or appetite?
no, doctor.
Okay, any lumps and bumps anywhere in your body?
No,
Okay, any changes in any weather preferences?
no.
Okay, and may I ask you now that what is your concern?
Why I am having this, doctor? Is it a skin cancer like this?
Okay, at this moment, actually, it's quite difficult for me to be sure about your condition. I have to examine you thoroughly and also make a thorough assessment by doing some tests, some blood tests, and also I might have to take some tissues from your skin. Okay, in accordance with the skin doctor's opinion. After doing all these things, I think I can have a better explanation of your condition. But as long as I have taken history from you, I think that you might be suffering from a condition named lichen planus. Okay, don't get bothered about it. Uh, don't get bothered about it. The term actually it's a skin condition in where your skin can get uh, a bit itchy and sometimes a bit violet color. Okay, uh, and sometimes for this condition your tongue can also get involved, like it is some lacy pattern white rashes can be white spots can be seen. However, I think that
Yeah.
okay. Mhm. Shall I continue?
No.
Okay.
So what are the differentials you have for is skin rash? What is
I
it?
think hmm, I think it can be lichen planus. It can be psoriasis. can be. It can be. I just cannot remember others.
Okay.
Any drug rash?
Okay. I will investigate.
I think first of all, it's important to have a clinical. I think a clinical diagnosis can also be important, and also some tests, specifically some skin biopsy and if immunofluorescence test, and also some basic tests like baseline tests like CBC with ESR CRP, then renal function test, serum urea, creatinine, and electrolytes with some liver function tests, and I think I will also have to go for some viral markers like HIV, hepatitis B, hepatitis C. Uh, for this, I have to take consent whether I need it, whether he or she consents or not. And I think these are the most important investigations.
What are your diagnosis for this rash over his mouth? Do you think it is lichen planus or anything else?
Uh, I think it's white. I think it can be lichen planus, and since it's not painful, I think it won't be oral candidiasis. But I think a leukoplakia can also be a DD here.
Okay, that's fine. Okay, in your history taking, that was fine. Except, can you tell me that what are the how will you describe a typical lesion of lichen planus?
Yes, flat-topped, violaceous, uh, violaceous, and flat-topped, and itchy. I think polygonal, flat-topped, violaceous, itchy,
Okay,
flexural surfaces that involves.
okay. Reticular pattern. That is an important
Reticular.
diagnostic trait.
Yes, yes. How should have I asked it? This reticular pattern.
Okay, can you tell me that how does it look like? Then he could describe. Looks like a net-like pattern. Some red lines or some white lines makes it just like a look like net.
Mm-hmm. Mm-hmm. Okay, okay. Mm.
Okay, but I think your history taking was fine.
Mm.
I don't have much thing to tell, just except one thing that when he said about oral rash, you should
Mm.
have asked about do you gargle after taking those steroid inhalers.
Mm-hmm. That is one very, very important. Yeah.
Okay.
Okay. And well, I have some questions that what investigations should have I done?
Based on investigations and except those going for the skin biopsy.
Yes.
Typical
And what is the
lesion.
treatment actually? I haven't remembered. Actually, I forgot.
Sorry?
What are the treatment for this steroid?
Yes, steroid.
Okay. And is there any precipitating factors? I actually don't remember now. Can you remember
No,
precipitating?
I cannot remember also.
Okay. That's all right. That's all right. Okay. So I think that's all for this case.